Well, tell me, I think we're all very interested, and all of you are so articulate in what does integrating research into the function of the CBO, your CBO, contribute?
One of the things that so if you know more about family life, you'll know that our hiring practice is somewhat peculiar, because we hire individuals that are from the community who don't necessarily have, the academic preparation that probably other organizations require. So they come into the organization to learn about, the workplace. And so for them, even more so than staff in other organizations, research is a very foreign, concept. And have at their clients from a different perspective, help them, understand that the more we ask, the more we know about the story of the clients that we're working with, the more effective we are in creating interventions, and the better they will be, after our interventions. So they embrace it. For I find it very rewarding that they have embraced this opportunity to learn in this way, and to use research as a tool, and they want to know more. They want to do more of these things. That was reflected in the evaluation that they did after Sarah from CT data presentation with them on data literacy. They wanted to know more, and it's a good thing for them.
Right.
Yes, I would say that for my community that I represent, or that we serve, mostly is a visibility. This population of Arabic-speaking folks who came to this country are usually blended in other subgroups, and it's hard to find them in the standard data collections that we do. So we provided a platform for this group, and whenever we are contributing to any research, there is an appreciation that we are now represented. We've seen when we had the data walk with Connecticut Data Collaborative, we mentioned only great win for data or research. The other factor is that it informs our practice, or our intervention with the community, because we need to know the specific needs for this population we serve. For instance, now when we had this survey started to focus on, that was last year, but now we are in the period of vaccine and vaccine uptake. We need to address that. So we started to tailor the SEHA project activities to fit this need. And we started to talk to folks about the vaccine. And there are many rumors about vaccine spread in these isolated communities. And this is what we learned from our interaction with the community in the events. And also there is another mini grant with UCAN that is addressing the attitude and behaviors of people and vaccine back uptake. We already conducted one focus group with folks, and the vaccine hesitancy came to the surface. So this kind of research and data collections inform our practice, help us to become more responsive to the needs of the communities we serve.
Great. Alixe, you want to add?
So I would echo part of that as well, in saying that like our population of folks are also very difficult to kind of collect data on, like the intersections that they exist at. So you're having, different ethnicities, races, but the commonality tends to be either their drug use in conjunction with their experiencing homelessness, or one or the other. And it's really difficult, I feel like, to get information on our people, and especially to do it in a way that is ethical and non-exploitative. That's very, very important to me, well, to all of us. And so this was a really nice opportunity to have something where I could just engage with them. Yes, the beginning part of the survey was pertaining to their substance use or the services they receive from us. But since they know me personally, it was, you know, easy for them to answer those things to me because they see me mostly every day. And then the other part was also being able to give an opportunity for their opinion and their worries and concerns to matter. So it was definitely more of an emotional thing again with them. A lot of folks had a lot of fear of losing loved ones, and some of them had already lost loved ones to COVID. And, you know, when you're outside, people aren't respectful of you. They don't ask you how you are. You know, you don't have a space to talk about it. So that really, for us, again, that kind of like data anecdotally and as well as statistically that we were able to gather through the survey about their health and how it changed because of COVID, it allowed for us to really reinforce our need for groups, and it pushed us to expand our backspace of our facility so that way we could actually start resuming soon, very small groups that will be staggered because we'll have finally enough space to actually distance everyone and have them double masked and have airflow and things like that. All staff and one who I'm like, I will help you. I will help you do the appointment if you don't what we do, and the need for us to really emphasize making sure our people are okay as well mentally, because if they're not doing well mentally and emotionally, they're not going to take care of their physical health as much.
So then that's what you've described is kind of the internal process. That is, what does research do for the decision-making, the development of programs by your community organization? What does it do for advocacy when you communicate with people who need to recognize that there's a Sudanese population, that need to recognize the needs of injection drug users, or need to recognize the needs of Hispanic women? What does research do in that realm?
Oh, it legitimizes it to people who are less likely to care, or, you know, for people who are more hesitant to care about certain populations. When you have like research with it and statistics and numbers behind it, I've noticed that people are a lot more willing to speak. Even if I can come at it in a humanistic way, like I kind of am in this space, because we all kind of know what we're talking about and doing, and some of us have already met each other multiple times. So I can talk about the humanistic part with certain crowds, but having research, again, legitimizes it in other settings, and I think also helps for further funding opportunities and other research opportunities, so that way our populations aren't being forgotten about and aren't never being, you know, looked into, because all of our populations have specific issues and interests that never get recognized.
But I also think that it raises an awareness, the opportunity to have these conversations with these clients raises an awareness in them as to, you know, what are some of the issues that they had not thought about, because we're asking questions that nobody has asked them before. And as I mentioned, you know, after the survey, there are a number of clients that are now engaged in advocacy activities, and they are writing letters to the legislature, and they're more interested in health disparities than they were before. And I think that some of these thoughts were triggered, you know, by some of the questions. You know, they wanted to know more, and they wanted to see why, you know, the state of affairs is the way it is in the community.
There's a question asking everyone, based on what you learned in the surveys, what would you do differently in your organizations moving forward?
Fawatih was just about to add to the previous point, and that's an excellent next question for everybody. So go ahead, Fawatih, make your earlier point, and then we can address that very question. It's a great question.
So in terms of advocacy, the data helped me tremendously to make the case whenever I talk about this population, or whenever I seek funding, or whenever I seek support. Because even when we discuss just the issues that this population go through, because before I used to say that I know this because I am one of this population, but now whenever you have a data support, that will give you credibility when you talk to funders, and when you talk to stakeholders, and also when you advocate for this group. And I will jump right into the next question that Joy asked. It was in the chat. So as I mentioned before, this survey helped us to improve our services and make them more responsive to the needs. And we more focus on addressing COVID-19 and the vaccination, the vaccine that's in place. That helped us tremendously.
You know, it's interesting. One of the things most of us researchers live in fear of is that we're not telling anybody anything they don't know already. Or even worse, that we're answering questions they never asked in the first place. So this idea of what have you learned from the survey has been nicely articulated and could even go beyond for further answers. But it's a very important question. And one of the things I think that reduces a little bit of the tension we have as researchers or applied researchers is that sometimes you don't learn anything new, but you learn to ask better questions as you move down the process. So you see something, it kind of brings it together, and then you can ask even a more sophisticated question after that. But Candida or Alixe, did you learn something that you didn't know?
Well, you know, as you said, the staff, you know, have benefited in the sense that they now know how to frame a question in a more, you know, effective way. So that helps them in other areas of their work that are not necessarily focused on research. You know, we learned that we don't know what we don't know until we ask. I mean, it is you know, important to ask. And we after the survey, we were able to get a grant to hire 5 community health workers. So the survey information, the survey findings informed, you know, their intervention. So they are out there now addressing the areas that need to be addressed, as opposed to just going, you know, guessing what we think is the right approach.
Alixe, you made gave us some examples of how things, in the nature of this question, what have you learned from the surveys in which you're going to then do something different than you ordinarily would? You have an example of that you could elaborate on a little bit?
Or something that we're going to do differently.
Yeah,
I mean,
something as a result of the research.
Of the survey. Well, I'll say, like, given the work that we do, the type of work we do, and like the intakes that we, like the questions we have to ask in our intakes and stuff, we already have very intimate views into people's lives. You know, we've already talked about housing, health issues that they already have or have not had, screenings that they need, vaccinations, even down to like skin infections due to their substance use. So since we do talk about a lot, as well as like incarceration, things like that, it wasn't that they taught the survey necessarily showed me, oh wow, you know, like there's more people that are without housing than aren't, because I conduct street outreach, and at that time I was doing it 5 days a week. I was very aware of that already, but this survey more so allowed me to realize, what can I do about it now? And like Candida said, like when you have that survey, you can use it for like other grant and funding opportunities, and that's really, really helpful. Again, I would say it's not like I never ask how people are. I always ask how they are, but some of these questions, how they were so specific, where they said, have you felt alone? It was things like, have you been having like a sense of feeling alone? Have you been scared? Have you had issues with sleeping and stuff? And I think that because that language was so clearly chosen specifically, and it was good language to use, because it definitely allowed for me to see a much deeper lens for the mental health implications of things. So I know what I did was we beefed up our like MOU with Wheeler and other facilities for behavioral health treatment, and have been trying to work with our homeless outreach team in order to have someone who specializes more in behavioral health, because what we're seeing a lot more of is kind of crisis response. And how can we wrap around our services more holistically? So trying to find more funding for stuff like that. Like, it'd be great if we could have a like LCSW or like something like that, not only just for a clinical sense, but a more therapeutic way to approach everything, because there's so many intersections to go about.
Good point.
I would
Joy,
also,
do we
Steve,
have
sorry,
to wrap?
Go
Do we
ahead.
have to wrap up
I
at
just want to add
11:30?
something,
Oh,
sorry.
okay. Yes,
I
go
just,
ahead.
just while Alex was talking, this came to my mind that the survey not only informed us serving this population, it also informed our partners. Because as I mentioned before, it's hard to find data about this subpopulation. So we shared the results with community mental health affiliate, with the city of New Britain, with the school district, all of those folks who are striving to serve this population. Now they are utilizing this data, and that's really beneficial to all.
That's great. So Joy, do we have to end at exactly 11:30? Is that?
Well, it's, I know a lot of people probably need to leave, but we're certainly happy to keep the conversation going for anyone who can stay.
I have to leave, sorry. I have another meeting at
Okay.
11:30.
I understand completely. Thank you so much. Let me just say quickly, before everyone leaves, that we're going to be sending everyone out some links to some resources that may or may not be helpful to your community organizations, some things that information people requested. And we'll also send out a little form. We want to know what sort of data and survey research skills, organizations would like to get more of. So we'll be asking that. So please respond to that when I send out something after the event. Okay.
We've got,
all right. Jay was going to just wrap up for a second. We've kind of run out of time, but.
So yes, we've run out of time. But this has been a wonderful discussion, and I will be sending out a summary of all of the advantages that you've all mentioned of doing research for both internal purposes and external purposes, which I would have shared with you to sum up, but I don't think we really have time to do it now. But there are two other important things that I want to mention. The second is that we are planning 2 more workshops. I think one possibility for the next workshop, since everybody has mentioned it, some aspect of it is to do a workshop on vaccine hesitancy, because now we are all involved in addressing vaccination and all of the issues around hesitancy. So I'm asking you, and I'm sure Joy will be asking you by email, whether you think that's a good idea, because we can host another discussion like this that offers some data, some summaries of what we already know for the city and the area, but also really builds on all of your experiences in that area. The third thing I wanted to mention is that we have a counterpart organization in just outside of London, England. They work with alliances like ICR does. And so they are very interested in a cross-national dialogue around vaccine hesitancy, because they face many of the same issues in very diverse areas of the city that we do. So that is another possibility to arrange possibly for our third workshop, dialogue with people in London from local communities and community organizations around some of the same issues. So again, I'm sure we'll be sending out more information, but if we have 1 second, any feedback on those 2 ideas. First one is a discussion among ourselves about vaccine hesitancy, and the second is having perhaps an international dialogue with counterparts.
I think both are really cool.
Would be fun, wouldn't it? And important, because they may have solutions that we don't have, and by the time we have the discussion, I think you've already mentioned a number of innovative strategies to deal with testing, and there are undoubtedly, I see Siobhan, I don't know if it's a real Siobhan or a photograph, but I'm sure there you go. But I'm sure that you are already dealing with vaccine hesitancy in some of your community work, as is Fawatih and Candida. So I think I know our time is absolutely up. So Siobhan, you look like you want to say something.
Oh no, I just want to say that, I mean, both of those sound like really good ideas as well.
Okay, they're both possible. So probably for the second one, we should wait maybe another 6 weeks, something like that, to see how people are faring and what the hesitancy situation looks like, what kinds of reservations people are still having as vaccine becomes more available and hopefully more accessible, and what strategies you all have been adapting and adopting, and also what some of the barriers are that will still exist structurally. So if that seems feasible, we can work towards that. And the international one is going to take a little bit of time. I'm guessing it might not be until, I don't know, we'll have to see how that goes. But it will follow the next one.
Let me just make maybe squeeze in a final 1 minute to say that there's no question that great work could be done if we had enough resources and enough personnel to really collaborate with each organization, all 8 or 9 that we've worked with and the many more we've missed. We do have an NIH grant in and have gotten small grants on the way. And so I was about to call on Stacy when we shifted, who is one of the people that have been involved in the grant, but Stacy Brown, Megan and Shana Cunningham, and Jay and others, along with the 3 organizations you heard from, are awaiting grants that would focus on the development of research as it addresses prevention and vaccination in the future. So there'll be more on that, and especially more on that if it gets funded. If it doesn't get funded, that's another story. So let me just say that we need lots of resources and lots of people to join this process of collaboration. And how we get that done will be something that CRA will be working on over time.
Okay. All right, thank you, Steve, and thank you so much to the panelists and everybody who participated in different ways. We greatly appreciate it, and we hope you'll join us. We'll let you know when the next event is, and